We haven't been doing testing or surveillance. We don't know what the population immunity levels are like in Ontario. We have no idea. We know there is a very contagious subvariant of Omicron. It's around, but we really can't characterize. We cannot model what's going to happen next. We do know that cold and flu and seasonal respiratory disease season is over in another month or two. And we should be looking ahead to that. We should be trying to make a decision in April to decide whether or not to maybe start reducing masking requirements in May. That would be the soonest that we could do it in order to be responsible. It's going to reveal a lot of tension between people who are really safety oriented and people who aren't. And the safest situation is if everyone is masked. When everyone isn't, people who want to be safe need to wear an N95 mask. That becomes now absolutely paramount. And not every parent is ready to do that. Not every parent has the means to do that. And so I think if we're going to rescind masks in any environment, we need to make sure we do it equitably. So we should be supplying masks to families that need them. We should be supplying masks to kids with comorbidities or health risks that make them particularly susceptible. We should make sure that staff, that teachers still have masks if they want them, if they feel they need them. So these are the things that we need to do, and we need to double down on air quality. If we want to move toward not having masks, and we know we have to do that one day, if we want to move toward not having masks, we need to do mitigation in other possible ways. We're not doing those things. We're simply talking about pulling masks off, and that's just not the smart way to do it. I think it's good to set a date on which you will decide or make a decision. In other words, to say on April 20th, that's the day that we will analyze the data and decide what we're going to do in May. And so people can understand that that reckoning is coming. But when that decision happens, it's not based on the calendar, it's based on the evidence. And so that gives you a sense of timetable, which is what everyone wants and what governments want to provide. But at the same time, it says these are the dates on which we'll assess the evidence rather than these are the dates on which we will take some kind of potentially dangerous or drastic action. The fact of the matter is we can't negotiate with the virus. We can't bargain. We cannot schedule the virus. We can't do any of those things. And pretending we can is simply treating COVID like a political problem. That doesn't work out very well.